You never thought it would be dangerous. After all, it was over the counter, approved, common. Maybe your doctor even prescribed it. You took it the way everyone else did, to sleep, to ease a pain, to calm your nerves, to avoid embarrassment. No one warned you. No one said it could leave a mark, not just on your memory, but on your brain itself. The danger didn't come like a bolt of lightning. It crept in slowly and like fog on a quiet morning. First, it was just a little fatigue, then confusion, a missed appointment, a word stuck on the tip of your tongue, a staircase that suddenly felt taller than it used to. You blamed it on stress, on age, on everything except the pills in your cabinet. But here's what you were never told. Some of the most common medications used by older adults, anti-inflammatories, bladder control drugs, steroids, antipsychotics, can quietly rewire your brain and, in many cases, triple your risk of a stroke. Every 6 minutes, an older adult suffers a stroke that could have been prevented. And sometimes the trigger is sitting right there, in the form of something they take daily, believing it's helping them. The worst part? Many of these medications were never meant to be used long-term in people over 60, but no one talks about it. You deserve to know the truth. You deserve to know what they are, and most of all, you deserve to know what safer alternatives exist before the damage becomes permanent. First, let's understand the battlefield. Your brain isn't just a lump of cells, it's a city. Neurons are the homes, blood vessels are the roads, oxygen is the fuel, and when a stroke hits, whether it's from a blocked artery or a burst vessel, that city collapses. Houses die, roads crumble, lights go out forever. The most common type is ischemic, where a clot forms in a narrowed artery and blocks blood flow. It's silent at first, until the moment when speech slurs, arms go weak, or time slips out of sync. The second type, hemorrhagic, is worse. A vessel bursts, flooding brain tissue, crushing it under pressure. Minutes become life or death. And here's the terrifying part. Certain medications increase your chances of both. Let's start with NSAIDs, non-steroidal anti-inflammatory drugs. You know them as ibuprofen, naproxen, diclofenac. Painkillers. They sit in every bathroom drawer. People pop them for headaches, joint pain, arthritis. They feel harmless. But for aging brains and hearts, they're anything but. These drugs increase your blood pressure. They stiffen arteries. They make your kidneys retain sodium and fluid, which means more volume in your blood vessels, more pressure on your heart, more risk for rupture. And if that wasn't enough, they also interfere with platelets, making clotting less predictable and increasing the chance of clots forming in the wrong places. Combine this with high blood pressure or diabetes, and the risk multiplies. NSAIDs can silently raise your risk of a deadly ischemic stroke. The same pill that relieved your pain yesterday could cost you your memory tomorrow. But it gets worse, because even if you don't take these pills daily, just using them a few times a week, especially in high doses or for chronic pain, can still pose a threat. And most people have no idea. They think, it's just Advil, until it's not. So what's the solution? First, never stop a medication without talking to your doctor, but have the conversation. Ask, is this the safest option for me? If you're over 60, especially with high blood pressure or kidney issues, you need alternatives. Acetaminophen, paracetamol, may be a safer first-line pain reliever for many. Even better, topical anti-inflammatory creams like diclofenac gels can reduce joint pain directly at the site, without affecting your entire cardiovascular system. And don't underestimate what movement can do. Gentle stretching, resistance bands, water exercises, physical therapy. Sometimes the best. Now let's move to the second category, bladder control medications. You might know them as oxybutynin, tolterodine, solifenacin. They're prescribed for overactive bladder, something millions silently struggle with. But here's what few are told. These are anticholinergics, and your brain depends on acetylcholine to think. Acetylcholine is like the oil that keeps your mental gears turning. These drugs block it. And not just in your bladder, in your brain. The result? Memory loss, disorientation, sleep problems, confusion, dizziness, brain fog that feels like aging, but isn't. And when blood flow to the brain is already reduced, due to age, blood pressure, or narrowed vessels, these drugs make it worse. They stiffen the arteries, limit oxygen, and can increase the risk of stroke dramatically. Thousands of seniors are prescribed these medications without realizing what they're sacrificing for bladder control. Some even take them just to sleep better, but the cost might be their ability to think clearly or remember their children's names. If you or someone you care for takes one of these medications, do this. Check the name, Google it, call the pharmacy, ask the doctor, is this an anticholinergic? Are there safer options? And there are. Beta-3 agonists like mirabegron offer bladder control without the brain fog, and for some people, lifestyle changes like pelvic floor training, bladder timing, and reducing caffeine can be just as effective. Third on the list, oral corticosteroids, prednisone, dexamethasone, the miracle drugs for asthma, inflammation, allergies. They work fast, bringing instant relief, but used long-term, they can quietly damage your brain and heart in 3 devastating ways. First, they increase blood pressure by retaining sodium and fluid, overloading your circulatory system. Second, they raise blood sugar, even triggering diabetes in some patients. And third, they increase bad LDL cholesterol and make your blood thicker. High pressure, high sugar, high clotting risk, that's the formula for a stroke, and it's playing out quietly in thousands of people every day. Again, it's not that these medications are evil. Sometimes they're essential, but the danger lies in using them too long, without a plan. If you're on long-term oral steroids, ask your doctor, can I switch to inhaled versions? For many conditions, like asthma or chronic bronchitis, that alone cuts the systemic risks. Or explore other immunomodulatory treatments that don't overload the cardiovascular system. Also, incorporate anti-inflammatory foods like turmeric, green propolis extract, and reduce refined sugars. These small shifts can allow you to reduce dosage over time. Finally, the most controversial, and in some cases the most dangerous, antipsychotics. Medications like risperidone, quetiapine, olanzapine. Originally created for severe psychiatric illnesses, now increasingly given to elderly patients with dementia, confusion, agitation, or simply trouble sleeping. But here's the buried truth. These medications, when misused, nearly double the risk of death in elderly patients, and stroke risk tripled. They lower blood pressure suddenly, leading to fainting and brain oxygen loss. They interfere with heart rhythm. They raise cholesterol, glucose, and weight, creating the perfect storm for stroke. And yet they're being prescribed like sleep aids, without exploring what the patient is actually feeling. Pain, fear, loneliness, restlessness. If someone you love is on one of these medications, especially without a clear psychiatric diagnosis, ask questions, be their voice. Ask, is this the last resort? What else have we tried first? Because most of the time the solution isn't a stronger pill, it's better care, more time, a calmer environment, soft music, gentle routines, a hand to hold, the kind of support that doesn't come in a bottle. What does all this mean for you? It means you need to see your cabinet not as a safety net, but as a battleground. Not every pill is your friend. Some are traps disguised as relief. If you're over 50 or caring for someone who is, start now. Review every medication, cross-check them online. Ask your doctor honest, direct questions. Don't settle for vague answers. Because the tragedy of stroke is not just its swiftness, it's how preventable it can be, how silent the warning signs are, how many of them were whispered through pills we were told to trust. But now you know better, and when you know better, you can do better. If this message stirred something in you, if it made you rethink the harmless pills in your home, don't let it fade into the noise. Subscribe to this channel right now, especially if you're over 50, caring for someone who is, or simply want real, unfiltered truth about your health. Comment I receive below if this message opened your eyes. I read every single one. When you write it, you're claiming clarity. You're not pretending anymore. Hit like if you learned something new. So this video reaches more people who might be on the edge of a preventable tragedy. And watch the next video on your screen. It reveals one more medication millions trust that could silently sabotage your brain. Watch it before your next dose.